Hi everyone, I'm Dr. Prabhakar C Koregol from Fortis Hospital, Nagarbhavi. Today, let's talk about the chest pain that you suspect to be a heart related or if somebody has told you that it is a heart related pain. In today's world, the heart attack has become so common and ubiquitous that any one of us can develop a chest pain that is related to the heart and that represents a heart attack. So, if you get a chest pain that is there anywhere from the upper part of the chest to the umbilicus, especially if it is associated with sweating or the severe pain, then it is likely to be a heart attack, though even a mild chest pain can represent a heart attack. You need to become very cautious because it has a life risk. So the moment you know the pain, if you are in an activity, the first thing you need to do is stop the activity and rest. Sit down, if possible, bed or the floor. And after that, call for help if there is somebody is around, or call for an ambulance if you are alone, and go to the nearest hospital that is capable of delivering the cardiac care, like heart attack treatment in the form of cath lab and the rest of the facilities. Every minute matters, so you should always reach a hospital that has all cardiac capabilities rather than going through the multiple places. Of course, if you are feeling very sick, then reach the nearest hospital. Ambulance transport is the best form of the transportation when you suspect a heart attack, but if that is not possible, you could be driven on your own vehicle by somebody else. Never try to drive yourself if you have a chest pain. And if there is an aspirin tablet available, have it either chewed or dissolved in the water. Then you reach the hospital. Once you reach the hospital, the emergency department you should go, and there will be an ECG that is done, and ECG in majority of the patients confirms a diagnosis of heart attack. If not, the doctor may suggest you some additional tests like echo and the troponin. And once the test is done, we are almost ready for treating a heart attack. It doesn't require too many additional tests. And when we talk about the treatment, in today's world, the best form of treatment is to do what we call as a primary angioplasty. That is opening up of the blood vessel, the closure of which has caused the heart attack. By doing so, we reduce the risk of death, we reduce the risk of damage to the heart and heart becoming weaker. So, the moment you suspect you have a heart related chest pain, go to the nearest hospital with all the facilities for treating, like an angioplasty, the medications, 24 hours of ICU availability, and never drive yourself to the hospital unless that's the only option. Always seek the help and use the ambulance services. Thank you. Hope this information helps you.